fix health care, the Democrats simply want to take it over. This is not about health care, it's about socialism. We see that Social Security, Medicare, and Medicaid are on the verge of bankruptcy. Our health insurance companies are loaded with cash. And Obama, like a good socialist, takes a look at all that money and tries to figure out how he can get his hands on it so he can give it to his buddies who voted for him. This is not about health care, it's about socialism. That's right. And now you're trying, part of this legislation is mandatory counseling for elderly people for end-of-life options. Basically, they are going to nag you to death. We are looking at the systematic extermination of our elderly people who paid for this system. This is not about health care. This is a return of the Nazis. I buried two of my friends who defended our Constitution. I don't have a problem laying down next to them.
I have a question about health, not about the health care bill, and I didn't really realize what this forum was going to be all about, but I did want, this is about the radioactive waste that has been dumped in the Missouri River floodplain, which is 8 miles upriver from the intake for, the water intake for everyone living north of I-70, and also upriver from the cities, the entire city's water supply. The EPA wants to just cap that high-level waste with construction rubble and clay. The other radioactive waste sites in the St. Louis area have been dealt with by the Army Corps of Engineers and are being dealt with in a professional manner. So my question is, why are we allowing this one particular high-level waste site that's in a floodplain not to be dealt with professionally? And I wanted to know what Senator McCaskill would be willing to do to solve that problem.
Virginia, we have had several meetings with constituents regarding that issue. We have had our legislative council in D.C. talk to the EPA, they talked to the Corps. The issue has been looked at. They've looked at the reports that have been issued, and Senator McCaskill at this time is standing by the reports that were issued by the Corps as to what should be done with that area.
By the Corps?
By the EPA.
Oh, by the EPA.
Thank you.
My name is Jim Rhodes, and I live in Glenville, Missouri. And I'm going to ramble a bit, but I do have a few comments. I'm one of the lucky people here, I think. I am a state employee, and I have really, really good health care insurance. And one of the reasons why the state of Missouri is able to give me that insurance is because it's a very large employer, and it's got a lot of muscle when it comes to negotiating contracts with private employers. I don't think very many people probably get the same level of health care as I do, and I'm very happy that I have it. But I really don't feel sorry for like the guy who was here who was a businessman saying he's 5 or 6 people he goes to negotiate with these insurance companies. They're huge conglomerates. Their primary motivation is making money. They don't really care about whether you're sick or not. Go see the movie Sicko by Michael Moore. It is a really good movie on the state of healthcare. A few other comments. I think this is a complicated problem. Folks, we have a problem in this country with healthcare. We spend far more per person than most other countries do, and we get poorer results in terms of our healthcare coverage. We have higher infant mortality rates. We have, maybe it's 50 million people without insurance, maybe it's 10 million. But it's too many. I don't see how anyone can be here and say that, who cares about those 10 million people? I've got mine, the rest of you, to heck with you. I mean, that's essentially what I'm hearing. You know, so people, they say, well, we've got mine, you know. Oh yeah, they'll go to some private charity, right, 10 million people. I've talked to my doctor, who's a very good doctor, and I asked him what he thought about this. He's a private doctor. He said he was sick and tired of dealing with the HMOs, and he would welcome a single-payer system. That's what my private physician told me, that he would welcome a single-payer system because he was tired of dealing with the HMOs. Another reason for healthcare costs going up, if you want to really get a good grip on this, I'm not a conservative, but read the book Capitalism and Freedom by Milton Friedman, because Friedman in this book talks about how the doctors basically get to control admissions to medical schools, and thus they control how many people get into the medical care. Yes, it is a supply and demand thing, but if you have a limited supply of doctors, guess what, folks? The cost is going to go up. It is a complicated problem, and we have got to deal with it in a comprehensive way. And the only way to do this is to stop with this piecemeal program we have right now and get together with some sort of a comprehensive program. And the only way to do that is to have a government, like my employer, the state of Missouri, use its muscle to try to get comprehensive coverage for all of us. Thank you.
Thank you so much for taking the time to be here. My name is Sally Sina, and I live in the city of St. Louis. I recently left my job to return to school, and I have COBRA coverage that costs about $1,000 a month, and it's very limited COBRA coverage. And I also have to have a tooth pulled, and a block of ice is the pain pill that I can afford, and I'm going to have to go into debt to have this dental work. And as a student, I can't afford that. And I believe that is the problem with our economy, with many small businesses, families going under because they can't afford the care that I have to have this tooth pulled. I can't wait. And when somebody's sick, they got to do what they got to do. And it needs to be affordable. And every other industrialized country in this world provides that for their citizens. Why does the United States have to act like a third world country in regards to its own citizens? And thank you for the time.
Our finance money. Any dental school. Be happy to see you. Yeah. I know. If you get excellent care, any dental school, we'll get other insurance beside COBRA. There's a lot available to you, like the government is.
My name is Virginia Asheville. I live in Crestwood, Missouri. And just a couple points. One is that Massachusetts passed a healthcare reform similar to what is being envisioned for our country. And in that case, the private insurance left the state, and the costs have gone up. They have skyrocketed in Massachusetts, and it's not solvent at all. It's on the verge of going bankrupt. Why would we make a similar plan and expect a different outcome? That's my first question. My second question is that many of the countries in Europe have gone to socialized medicine, as has Canada. When they did so, their unemployment rates went from a threshold similar to what the United States historically has had in the 8% range, and they now tend to hover baseline in the 12 to 15% unemployment in those countries, and it correlated very closely with when they made the move to socialized medicine. Do we also expect, as we pass this national health care plan, to see so many more people unemployed and unable to pay into taxation, and also needing the government to provide this health care because they won't have a job and an employer to help fund it?
Yes.